Of all of our senses, our eyesight is the most precious. Yet as we age, our eyes become extremely vulnerable to a condition that can lead to blindness: macular degeneration. Macular degeneration occurs when crucial cells in the center of the retina begin to die, resulting in blind spots and distorted vision. 1/3 of adults over age 75 will develop this condition, and until recently, there was very little anyone could do to stop it.
Macular degeneration affects your ability to see, and sight affects every aspect of our lives. Patients with early macular degeneration may have very minimal or no visual impairment. But as macular degeneration advances, it affects our normal of activities of living. It affects our ability to read, to drive, to watch TV, to see a face across the room and to recognize somebody.
Every senior should have an annual eye exam. Eye care professionals can detect the earliest changes of macular degeneration during these exams. Patients that are at higher risk can monitor their vision for very early changes at home using an Amsler grid chart. Early detection is essential in achieving the best treatment for these patients.
Macular degeneration is a disease that can result in loss of vision quite rapidly. However, if detected early, it can be treated and vision can often be preserved and even improved. On the other hand, if the disease progresses without treatment, the retina can be damaged and vision can be lost permanently.
There are two forms of macular degeneration: dry and wet. Wet macular degeneration is much more severe. While it accounts for just 10% of all cases, it results in 90% of the cases of legal blindness.
Wet age-related macular degeneration occurs in about 10% of patients who have dry macular degeneration, and usually the symptoms come on rather suddenly. Oftentimes there's blurriness, distortion, wavy lines, and sometimes blind spots. And about 200,000 new cases of wet AMD are diagnosed every year. And basically what happens is that there are proteins which are called vascular endothelial growth factor, or VEGF, which are stimulating growth of blood vessels underneath the retina, creating leakage in the macula, which can damage the macula and cause irreversible central vision loss.
Although macular degeneration is common, there are ways to cut your risk. Eating green leafy vegetables, not smoking, and regular exercise are all ways to reduce the chances you'll develop it. If you do get macular degeneration, there is hope. In 2006, the FDA approved an angiogenesis inhibitor that stops the growth of blood vessels. This treatment is considered a major medical breakthrough.
The standard treatment for wet macular degeneration now is injection of anti-VEGF drugs called Lucentis or Avastin. They're very effective in that they can stop progression of vision loss in 90% of the patient and can improve the vision in 40% of the patients.
Macular degeneration is a condition that can affect nearly every part of a person's life: their mobility, their employment, even simple joys like reading. But people with low vision can still lead full lives. The key is learning to adapt and asking for help.
When patients have loss of central vision, they can use magnifiers and more illumination to make it easier to read. They can use larger televisions, but sometimes it's still very difficult and frustrating for patients. Often a low vision specialist can be helpful to really gear them towards the correct visual aids that are more appropriate to their needs.
Macular degeneration can be detected by your eye doctor before you even start to lose your vision. Getting yearly exams is the most effective way to help protect your eyesight. With 5 locations, Retina Consultants of Connecticut is the largest retinal referral practice in the state and one of the largest in New England. This team of specialists provides treatment for all retinal conditions, including macular degeneration, ocular trauma, and diabetic retinopathy. For people with diabetes, regular checkups are critical to preserving eyesight.
Diabetics are much more likely than the general population to have serious eye problems. When patients have diabetic retinopathy, damage to their retina, they may not know it. They may have absolutely no symptoms. So it's critical that every diabetic have at least a yearly eye examination by a qualified eye doctor, at which time their pupils must be dilated and the retina thoroughly examined.
The main treatment for diabetic retinopathy remains laser. This can be supplemented with injections of medications in the eye, very similar to what we inject for macular degeneration. The laser treatment is helpful in stopping swelling of the retina, the diabetic macular edema. So if you think of a leaky garden hose, the laser sort of plugs up those leaks.
The team at Retina Consultants are all experts in the delicate field of retinal surgery.
While many conditions can be treated in the office, some serious retinal diseases require surgery in the operating room. Fortunately, the field of retinal surgery has undergone dramatic advances in recent years. In particular, the instruments that we use have become smaller and more precise. This results in less postoperative patient discomfort and better vision.
As consulting physicians, the doctors at Retina Consultants work closely with your primary care physician to provide state-of-the-art eye care. Their expertise and compassion is evident to every patient who needs their help.
The reason why I decided to become an ophthalmologist is because as a senior in college, while playing squash, I got hit with a squash ball. My eye got filled with blood, and the treatment at that time was hospitalization and patching in both eyes. I was in the hospital for 5 days, and that was the worst time in my life. Once you lose your vision, you realize how important the vision is. I developed a purpose to help people, to prevent them from losing the vision like I did.
The most common causes of blindness in the United States today amongst adults are diabetic retinopathy and macular degeneration. As ophthalmologists, we are blessed to be able to treat these patients.
I think it's wonderful to be able to offer treatments to patients who otherwise would be experiencing vision loss. We have a lot to offer these days.
Vision affects every aspect of our lives. For many patients, loss of their vision means loss of independence, and this could be quite devastating. Fortunately, we are able to provide medical and surgical treatments to retinal diseases that can improve vision and really make an impact in their lives.
Of all the senses that you're afraid to lose, I think vision is really the most fearful. And so to be able to save vision is quite precious.
We can prevent blindness in so many people that we couldn't before. It's an unbelievable opportunity to do this today.
Eyesight is critical to nearly every aspect of everyday life. If you think you may be suffering from vision loss, don't wait another day. Contact Retina Consultants of Connecticut. For more information, visit us online at retinact.com.